We are Team 11, and our care plan is about heartburn. So our case is AB is a 60-year-old male patient who visits a local community pharmacy today with complaints of heartburn after returning from his recent trip to Italy. AB denies having history of GI bleeding, constipation, diarrhea, and past GI surgical procedures. AB takes Aleve twice daily for his arthritis, and he enjoys swimming for his exercise and joint health. Other medications include multivitamin 1 tablet once daily, glucosamine complex 1 capsule once daily, and calcium carbonate, TUMS, 1 tablet 3 times daily for calcium and heartburn. He has no known drug allergies. AB expresses how he traveled to Italy last week, where he ate heavy portions of wonderful pastas with lots of fresh tomato sauce. He returned home about 2 days ago, and he's asking for your recommendation on treating his heartburn.
The subjective information from this case is that AB is a 60-year-old male who returned home from Italy 2 days ago complaining of heartburn after eating heavy portions of wonderful pasta with lots of fresh tomato sauce. He denies past medical history of GI bleeding, constipation, diarrhea, or GI surgical procedures. AB states that he has arthritis and enjoys swimming for exercise and joint health, and there is no objective background associated with this case.
This patient has no known allergies, no known drug reactions, and no alerts. AB currently takes 4 medications. He takes a multivitamin, strength unknown, for general well-being, which he takes 1 tablet by mouth daily. He takes a glucosamine capsule for unknown reasons. He takes 1 capsule by mouth daily. He also takes calcium carbonate, or TUMS, strength unknown, for calcium supplement and heartburn, which he takes 1 tablet by mouth 3 times daily. He also takes Aleve, strength unknown, for arthritis, which he takes 1 tablet by mouth twice daily. The start date and adherence information is unknown.
The indication for this patient is heartburn. Our goals for AB are to improve his heartburn-related symptoms to once per week within 2 weeks, and improve his heartburn-related symptoms to once per month within 6 months. The drug therapy problem for this patient is indication. He needs additional drug therapy. AB needs additional drug therapy to treat his heartburn symptoms. The therapeutic options we chose were ranitidine 150 milligram tablets and omeprazole 20 milligram capsules.
We suggest AB to take ranitidine 150 mg, 1 tablet by mouth, as needed 30 to 60 minutes prior to eating meals. Can take up to 2 tablets per day, but don't exceed 300 mg per day. Given patient's age is already 60, there is increased risk of osteoporosis with omeprazole due to decreased calcium reabsorption, so we would not recommend omeprazole at this time. In addition, ranitidine has much more decreased side effects, so we decided to select ranitidine.
For non-pharmacological treatments, we recommend the following. AD should avoid acidic foods and beverages which could precipitate heartburn. AD should eat smaller meals and reduce intake of dietary fats. AD should avoid eating within 3 hours of going to bed or laying down, and elevate the head of the bed by placing 6 to 8 inches blocks underneath the legs at the head of the bed. AD should also avoid any usage of tobacco or consumption of alcohol and caffeine.
As part of our follow-up, we recommend a face-to-face follow-up in 2 weeks. The patient should be instructed to contact physician if symptoms worsen or they experience side effects. We evaluate for efficacy to ensure the patient has reduction in heartburn symptoms down to once per week. We evaluate for safety by confirming absence of possible side effects, including heartburn, dizziness, rash, or confusion. We will also have a phone follow-up in 6 months to determine long-term efficacy. These are our following references.